CDC says if you don't have COVID symptoms, you probably don't need to get tested, even if you have been exposed. Now, previous guidelines said viral testing should be done on those with recent or suspected exposure, even if they had no symptoms.
Now, this change in direction is causing some confusion. Anchor Damany talked to one medical expert who is not 100% on board with this new guidance.
Doctors have been saying for months people who have been exposed to other people with COVID-19 should get tested. Now the CDC says if you don't have symptoms, no need to get tested. And a doctor locally says he doesn't understand the change in direction.
The answer is no. I can't explain why they did that.
Dr. Shelton with Tryon Medical Partners says since the pandemic started, science and data has guided doctors to help care for patients with COVID-19. Now, with the Centers for Disease Control changing guidelines on who should get tested if exposed, it's raising red flags. He's questioning what new information has led to this dramatic shift.
As medical professionals, we want data. Like, we want to understand the why behind something. And once we better understand that, maybe that, is what we should be doing.
Right now, the CDC hasn't clarified the why behind the change, but it's one state leaders say they are not going to follow.
The CDC did change their guidance, but North Carolina has not. We still recommend that folks are getting tested when they have symptoms or when they are exposed.
If they had more than 15-minute exposure and they were closer than 6 feet, they're at risk. So what we're trying to do here is, prevent the spread.
Dr. Shelton says with infection numbers trending downward in North Carolina, the current plan of wearing masks and more testing is working. He says each patient is different, but when it comes to curtailing this pandemic, doing what has been proven to work is his game plan.
It's too soon for me to commit to that change just yet. So things are constantly evolving. Like, we can't make this pandemic perfect.
State leaders say testing is important, and if you feel you may have been exposed, they say there are more than 600 testing locations for you to get tested across the state. Back to you.